Hi, welcome to Psychologies. I'm Angharad Boyson, barefoot coach, founder of Bright Rebel Coaching, and creator of this How to Recognise Seasonal Affective Disorder coaching program. In this short video, we're going to look at some self-care tips, and we're going to look at some questions that will help you determine whether or not you need to get some medical assistance for your seasonal affective disorder. This is week 4 of 4, so go back and watch weeks 1, 2 and 3 as well. You can get access to the full course content, including weekly journal workbooks, by subscribing to Psychologies. Just follow the link in this video. If you're already subscribed, you just need to head over to the Life Leap Club page on the Psychologies website and register or sign in. So today I'm going to talk you through a series of quick self-care tips that will either help you if you've got a case of the milder winter blues, or help you try and keep your SAD in check whilst you're waiting for a diagnosis, which can take up to 2 years with some practitioners. First tip, get as much sunlight as possible. Get outside, get as much sunlight into your home or your workplace as possible. Tip 2, eat well. Okay, so I'm not saying don't eat white bread or pasta ever, but think about how you can supplement your diet with whole wheat, with oatmeal, brown rice and bananas, all of which increase your serotonin levels. Add to that omega-3 rich foods such as oily fish, rainbow trout is my favourite, walnuts, flaxseed, soybeans. All of these boost your mood, and they can also boost the effectiveness of antidepressant medication too. Third tip, exercise regularly. That doesn't have to look like going all out every day for hours. As little as 30 minutes a day for most days of the week, even something as basic as walking, has been shown to increase mood, improve self-esteem and increase energy levels. And then the fourth tip is make a plan of how to deal with your stressors. So we talked last week about dealing with seasonal based stressors. Look at how you can reduce or minimize stress, as well as including something like yoga or meditation or mindfulness on a regular basis to help you deal with that stress. I'm going to run through a series of questions. If you answer yes to most of these, then seasonal affective disorder could be bad enough that you should really consider going and getting some medical assistance. A diagnosis will lead to clinical intervention, which could look like light box therapy, counselling or antidepressant medication. And there is a strong record of people being helped with SAD by clinical intervention. So if you answer yes to these questions, go and get yourself some help. So the first one is, do you feel worthless? Do you feel like just you're not worth anything? Does low mood affect your relationship and or your libido? Is your quality of life markedly different and worse in the months that you're affected by SAD? Do you feel depressed more often than not in those seasons where SAD affects you? Do you feel hopeless? Does it feel like you'll never resume normal life again? If you answer yes to any of those questions, and or if you're plagued by thoughts about self-harm or suicide, then that is a great indication to go and get some help for your SAD. Plenty of people do. You can get help and it will really work. I hope that this whole series has helped you decide whether or not SAD is something that's impacting on your life, or whether it's a case of milder winter blues that you can self-manage at home. Either way, I wish you the very best for the future, and I'll see you soon.